Hi, I am Dr. Naveen Kyagu, orthopedic surgeon, specialized in joint replacement, arthroscopy and sports medicine. I provide educational videos for patients and for people who are interested in orthopedics and orthopedic injuries. And one such person who wrote me a mail is Mr. Stephen. He says, I am an active badminton player, but ever since my first shoulder dislocation, my performance has declined. Subsequently, I have dislocated the shoulder 3 times, following which now I am scared of taking overhead shots. Can you tell what I should do to improve upon or get rid of this problem? So, it's shoulder dislocation. Dislocation is nothing but separation or when two surfaces are out in place. That is, for example, a joint is made up of either a ball on a socket or 2 balls joined together to form a joint. So this is covered by the sheath so that this joint never dislocates in life. But unfortunately, due to injury, what happens? Suddenly these 2 surfaces dislocate. This gets displaced from one another. So once this happens, simultaneously there is a rent or a tear that happens in the sheath. This tear is prone for subsequent dislocations because at the extremes of movement, the ball gets out of the socket or out of the other joint surface. So he has told for Stefan, it is 3 times dislocation. He has to be further evaluated with MRI or CT. Once the MRI or CT is done, we will know whether it is purely a soft tissue or only the sheath that is damaged, or along with the sheath there is a bony damage or bone loss at the site of the dislocation. If there is 2 with bone loss, then a separate method of treatment is there. If it is only the sheath, then wonderful procedure is there, it's arthroscopic repair. Once we do the procedure, the incidence of subsequent dislocation reduces drastically. So for Stefan's case, it is arthroscopic first evaluation and then going for arthroscopic repair. So for such interesting discussions, I am very glad to answer your mails. Please write to Dr. Naveen, drnaven @alphaorthoclinic.com, and you are welcome to leave your suggestions and comments, and you are welcome to share your experiences if you have had similar injuries, or if you have one such friend who has got such treatments in the past. You can share your experiences. I mean, I'm glad and I welcome you all in such discussions. For subscription of, you can subscribe below and leave your comments.